Hi, I Dr. Ijaz Ahmed Bhatt, Senior Lecturer, Department of Prosthodontics, going to discuss a topic on orientation jaw relation. Jaw relation or maxillomandibular relationship. It is defined as any one of the infinite spatial relationship of the maxilla to the mandible. Jaw relation record or maxillomandibular relationship record. According to definition, a registration of any positional relationship of the mandible relative to the maxillae. These records may be made at any vertical or horizontal or lateral orientation. Classification of jaw relations. Jaw relation is mainly of three types, that is orientation jaw relation, vertical jaw relation, and horizontal jaw relation. Vertical jaw relation is again of two types, that is vertical jaw relation at rest and vertical jaw relation at occlusion. Horizontal jaw relation is of two types, that is centric jaw relation and eccentric jaw relation. And eccentric jaw relation is of again two types, that is lateral and protrusion. These are the equipments which are used to record the jaw relation, particularly the bite and other instruments which are used to record the jaw relation. Firstly, before we go for the orientation jaw relation, we have to check the lip support and the visibility of the maxillary rim. For this, we set a plane by Fox plane along the alar tragus line and interpupillary line. Now, what is orientation jaw relation? Orientation jaw relation, according to definition, they are those relations that orient the maxilla to the cranium in such a way that when the mandible is kept in its most posterior position, the mandible can rotate in a sagittal plane around an imaginary transverse axis passing through or near the condyles. What is hinge axis? The hinge axis is defined as an imaginary line passing through the two mandibular condyles, which are the posterior reference points, and around which the mandible may rotate without translatory movement. Terminal hinge axis, when the condyles are in their most posterior position in the articular fossa and the mouth is purely rotated open, the axis around which movement occurs is called a terminal hinge axis. The maximum range of terminal hinge axis rotation is about 12 degrees. And at this time, the interincisal opening is in average is 18 to 25 millimeter. Now, you can see in the hinge axis passing through the two condylar heads, and when patient moves 10 up to 12 degrees, it is only a purely rotational movement. Clinical uses of the terminal hinge axis. The location of the transverse hinge axis serves only to orient the maxilla and to record the static starting point for the functional mandibular movements. It does not record centric relation or condylar movements. It allows the transfer of the opening axis of the jaws to the articulator so that the occlusion would be on the same arc of closure as in the patient's mouth. The hinge axis recording is required to check the accuracy of two centric records. It helps in proper positioning of the casts in the relation to the intercondylar shaft. The vertical dimension of occlusion can be altered on the articulator after we transfer the hinge axis. Thank you.